question about osteoporosis. I know the ideal is not to use medication, but until you get to the point where you don't, is reclassed in the once-a-year IV drug any better than Boniva and Actonil, et cetera?
No, my personal opinion is that unless you have a serious fracture of your collapse of your spine, and and you have some pain with the spinal collapse and history of severe fractures, those medications are too dangerous to be used.
Even the reclass falls into the same category?
Yes, they're all bisphosphonates, all similar side effects. And the fact that it lasts for a year, you only need one shot a year, is indication that how long it stays in your body, for years and years.
Yeah.
And if you have a side effect to it, and you stop it, it's going to be there for years in your body, causing those side effects.
And all in that same vein, there is some literature out, it's made the nightly news programs and all, about a diet that is 20% and divided 20% and 80%. One's acid, one's alkaline. I get confused which is which. But you're supposed to combine your foods at every single meal in that proportion, 20% to 80%, and they've had phenomenal results.
You only get one question.
It was all about osteoporosis.
Just kidding, just kidding.
Okay, you haven't heard of that?
No, there's lots of diets out there that flood the market of all description. Matter of fact, there's probably more than 100 diet books published each month with all kinds of crazy ideas. But here's the bottom line, is that when you eat a healthy diet and your diet is naturally and your body is naturally mildly alkaline, and if you eat a lot of meat in your diet and a lot of animal products or a lot of fish, your body has to produce a lot of acid. And that acid tide that comes from the liver, and it's called the portal flow in the digestive tract. As you're digesting foods, you're digesting and absorbing all those acids that were produced and secreted into the digestive tract, gets absorbed into the bloodstream. And your body has to deal with those extra acids and has to excrete them in the urine. And in the process, you lose calcium, you lose other minerals, and it's stressful on the system, right?
Okay.
Once your diet, we remove that high load of animal products, almost any type of plant-based diet, all descriptions, you can't make a plant-based diet become acidosis or acidotic. There's no special combination, special balance of foods. Okay. This food, more nuts, less nuts, higher this, more this, to get this perfect balance of alkaline acidity. That's just ridiculous.
Okay.
So
I'll tell my friend.
The point is that a healthy diet is already alkaline-based, but that's just one example of what makes a diet good. Not the main thing. A diet should have a good glycemic response, but that's not the only thing that makes a diet good is a glycemic response. A diet should be high in nutrients, but high in nutrients isn't the only thing that makes it good. A diet should be, have the right balance of fatty acids, but the fatty acid balance is the only thing that makes a diet good. A diet should have enough, you follow what I'm saying? Resistant starch. Fine, we can go down the list.
Right.
But when you do the right type of diet, all those things naturally fall into place in the right proportion.
Thank you.
So try to get out of the gimmicks, the tricks, the hooks. When you're trying to write a diet book, they got to have some hook, some trick, some gimmick that makes it different.
When I hear you talk about combining nuts and seeds with greens to make everything more nutritionally available, I think about the old days in vegetarianism when they talked about combining rice and beans, and they found out later it has to be done, within hours or a day or something. Would that be true too with nuts and seeds and greens?
No. I'm saying that when you have some fatty food, like nuts and seeds, with your green vegetables, you get more absorption of the fat-soluble compounds, and the fat-attracted phytochemicals get absorbed more readily into the body. And you're saying if you have the fat 2 hours later as a snack, or later on during the day, will it still cause those nutrients to be absorbed better? And the answer is no.
Okay.
And it's also not true. It's also, there's some value to biological availability of protein as well. It's not that idea has no value. It's not as important as we thought, but there's something, because if you're an athlete and you do a lot of exercise, the biological value of the protein after that exercise event is somewhat better if you actually have the full amino acid complementation at that meal, because you're not going to have so much loss of amino acids that your body's not going to balance out. So there's still some balancing effects, and there's also some loss of the amino acids that are not balanced. So even though it's not so important, it has some importance when you're trying to maximize muscle mass or athletic power or something like that. So it's not a completely valueless concept.
Okay, and does avocado count for that, or is it only nuts and seeds?
No, just fat in general facilitates the absorption of these fat-soluble compounds.
Okay.
So yes, and the best way to get our fat is with nuts and seeds.
Okay.
Or avocado.
2 hours after you eat, what is the ideal glucose level? The number?
Well, we'd like your glucose level to come back to normal after a meal. And 2 hours is a reasonable time frame for it to come back to normal. And normal which is below 100.
I was wondering if you could make any comments on potential of reversing dementia.
We can improve people slightly, but dementia itself is pretty much an irreversible condition because the garden variety of dementia means the brain has shrunk due to atherosclerosis. So when you have a heart attack, part of the heart dies and doesn't come back. And as you have atherosclerosis, your brain, it's not a stroke, but just hardening the arteries, delivering decreased oxygenation and nutrients to the brain over time. The brain, different from the heart, gradually shrinks little by little. And these people on CT scans or MRIs have smaller brains.
Right. I'm dealing with someone who is age normal on their MRI and has cholesterol's unmedicated in the 250 level.
Right.
Anyway, I didn't know if possibly you could clear out the arteries in the brain as well as you do in the heart.
That's the thing. That's exactly the point. You made that was the proper idea. That in the early stages, when you're starting to get decreased oxygenation and the brain has not shrunk yet, and there's not the plaques that come around with Alzheimer's, with Alzheimer's disease and other degenerative diseases of the brain, and the brain hasn't lost its size, there's still the potential to inhibit, recover a little bit, prevent it from degenerating. But like any other disease, as it advances, you have irreversible pathology that can't come back to normal again.
Please address the impact of diet and lifestyle on eye conditions, particularly dry eye syndrome, glaucoma, and cataracts.
I mentioned earlier that the Shea Eye Institute at University of Pennsylvania submitted $1 million grant into the NIH to do a combined study with me, and they did a wonderful presentation of this, working with these doctors there to put all the literature together to show that a high nutrient diet with a high intake of the broad spectrum of phytonutrients and carotenoids are very effective at preventing and even reversing eye disease, and there's data to support that. And that's where they really thought this grant would be accepted, because the pilot studies have already been somewhat positive. On the other hand, my experience over the last 20 years, even though cataracts are related to a poor diet and lack of proper nutrition and getting excessive sunshine and genetic component, even though all that's true, that once a person has them, I have not seen them in my years of medical practice with people adopting nutritional excellence, not seen them reversible. It's almost like the lens of the eye is like your fingernail, and once you have a defect in the nail, body's not going to get its blood supply into that nail to take it out. It's a part of the body that doesn't reverse itself. So I think that my opinion is that cataracts would not be reversible through nutrition. Preventable, but not reversible once you have them.
Okay. What about glaucoma and dry eye syndrome?
Well, glaucoma, I've had a lot of patients who've reversed their glaucoma. And a lot of times they've eaten a healthy diet, done some fasting, and depending on the type of glaucoma, but I've seen lots of people reverse their glaucoma through using what we're talking about here, especially when they do the diet with some intermittent fasting. Dry eye syndrome could be many different causes, and sometimes there could be scarring of the tear ducts that are irreversible, and sometimes it could be due to scleroderma and other diseases that can make recoveries from. But with some of these diseases, in the later stages of the diseases, the glands around the eye can atrophy and become scarred. So the answer is sometimes yes, sometimes no.
I wanted more clarification, unless I heard it wrong, but when you were lecturing about the blood pressure and something about it could be normal blood pressure, but in the brain it would still be high?
Yes.
And I've never heard that, and the neurologist, everybody that I've ever heard counseling patients have said, be compliant with these meds. As long as your pressure is maintained, you're okay. You're not going to, very small chance of ever having a stroke or any problems. And this seems to this seems so different from what I've heard all these years, that you can still have the high pressure. So is there a blood pressure med that also affects that and lowers the pressure even in the head and the body?
Yeah, when the slide that I presented on beta blockers, it was beta blockers alone who has the history of lowering peripheral blood pressure and not lowering central nervous system blood pressure. So even though I have a very creative mind, it's not something I made up. I'm just reporting what's the medical literature.
So it's just the beta blockers?
Just the beta blockers.
Okay.
And one of the reasons why beta blockers don't seem to enhance or lower mortality, people taking them still have the same amount of heart attacks and strokes. The researchers give the mechanisms why beta blockers don't seem to work, even though they lower blood pressure. They raise glucose, they lower the diastolic without lowering systolic enough. They cause, we're saying they don't lower central nervous system blood pressure in the brain, just peripheral blood pressure, as much as they should. So the answer is they might have some effect on lowering the blood pressure, but proportionally it doesn't do the same thing in the brain as it does peripherally.
Okay, and then on your website, I bought that squeezer.
Right,
And-
isometric
Yeah.
exercises.
And I didn't hear you mention that, but it has helped me.
Very good.
But-
Well, that's right. It's that we want to use those 3 types of exercise to maximally lower blood pressure in conjunction with an excellent diet. And the 3 types of exercises are an aerobic activity, which elevates your pulse, and you maintain that elevated pulse for a long period of time, 10 minutes or more. Interval training, where you where you push yourself to elevate your pulse further, where you're doing it within 2 to 3 minutes, you have to stop because you're getting kind of out of breath. To put more elastic stress on the blood vessel wall, and then you walk slowly, you regain your breath, you do something slower, and then maybe 5 minutes later, 10 minutes later, you do it again at more intensity. That's called interval training. And so both, and then the third one is isometrics, where you're actually squeezing, pushing, and those little machines time you and force you to isometrically squeeze and hold it for long periods of time at a high degree of effort. And all 3 of those different types of exercises, as well as meditation, yoga, and things like that, all having a comprehensive exercise program can be very effective adjunct to nutrition at getting people's blood pressure down.
Have
So
you gotten much feedback on the isometric one?
I have, and most people get benefits from it. But of course, this is a very holistic approach, and that holistic means diet, exercise, proper sleep and rest, all those things. So the exercise component is a big part of it.
Okay, and how do the BP meds make the fracturing worse? The blood pressure meds, something about cause more hip fractures? You were talking about that.
That's right. Blood pressure medications are related to hip fractures because people get lightheaded from hypotension, and they get it, at some point in the day, they don't drink, they forget to do something, they overtake the medications, they vary their sodium intake, their blood pressure drops, they faint, they fall on the floor, and they break their hips.
Dr. Fuhrman, what is your opinion of having a little bit of that pomegranate juice or coconut water?
I think that coconut water is fine. It's really just water. It's not that much sugar in it. It's not even that sweet. So I think it gives a little flavor. I think coconut water is okay to cook with or to drink some. I think it's okay. Pomegranate juice, I think, is an excellent food because pomegranates are such a great food. And I think this last year, there was the greatest pomegranate season ever. I mean, it was in season for like 6 months, and I was peeling pomegranates, buying as many as I could, peeling them and saving them in my freezer, frozen in bags, so I can use the pomegranate seeds to chew the whole seeds, putting them on salads. And part of the year when they're not available, I do make sauces and do some things with pomegranate juices. So I think it's an excellent food, but I mostly think that those little, light reddish seeds of the pomegranate are really a superfood that we should include in our diet when they're in season. That's the most important thing.
Okay, and let's say you have dinner finishes sometime between 6, 7 o'clock at night, and you get up in the morning and you want to go do a high-intensity weight workout 8 o'clock in the morning, but
Right.
yet you find that towards the end of it that you're getting fatigued with a feeling like you wish you had something to eat before you started the workout. Is there something that you can eat in the morning before you do a workout like that, or are you better off not putting anything in your stomach?
Well, I guess it's okay to eat something light before a workout like that. You could have a half of an orange and some water, or a piece of melon. Something very light and easy to digest might be okay. I don't find in most cases that's necessary. And when I do a heavy workout in the morning, I can sometimes choose to eat something, and most of the time just have water and go work out for hours and not worry about that. So I think that for most people it's a non-issue.
When someone has, I'm not sure the medical term, asthma of the esophagus, where it's difficult for food to get down at times, can this diet resolve that? Because the doctors always, want to offer drugs.
Yeah, I mean, there's a whole bunch of different causes of various conditions. I gave an example of a person who was having spasm of their, stomach and esophagus due to vitamin D deficiency. right? But people get all kinds of crazy symptoms from bad nutrition, from malnutrition, from toxicosis, from, a lot of toxic buildup in the body. One part of the body spasms, cramps, is more irritable, is inflamed. So certainly I think that you'd be amazed to see all the kinds of unusual and almost crazy symptoms the body can develop that are almost unheard of, that people can get well from. And a lot of people get well from things they didn't even know they had, that there was a solution to, or it wasn't their main complaint, but they're trying to get healthier, and these little things that still go away, they didn't even know were fixable. So clearly, I think there's hope for a person like that.
My questions are around metabolism, and the first is, I want you to review what you were saying about those of us who actually truly have lower metabolisms. It looks like that we're genetically predisposed to live longer. And there was something that Joe Cross said after the movie about, even though that he had gained weight, he had more that was muscle. And I can't remember the verbatim words, but it sounded contradictory, like that he had more muscle
Right.
so he could eat more.
Right. Somebody in the last 6 months gave Joe Cross some bad advice. And because of that, he listened to them, and it kind of hurt his health and made him gain some weight. And I had a talk with him the next morning and set him straight and reviewed and reinforced what the right way to take care of his future health for his future life and to be well for his future. So he was a little confusing there. So
Okay.
the idea that you're going to eat more protein, do more weightlifting, put on more muscle, and that's going to make you lose weight more, that's ridiculous. In other words, you don't get healthier by putting on more muscle and fat, and that's going to help you eventually lose weight because your body's going to have more muscle, you're going to have muscle that's going to burn more fat off your body. That's not the way you lose weight. You lose weight by, that's the thought out there on these, do this trick, do that trick, speed up your metabolism, build your muscle. It's not effective, and it leads to chronic illness and down the road to destroying your health.
Okay, so
Because that's what the advice comes from out of that community of people who are physical trainers, who think high protein is better, and that kind of thing. So the
Okay.
bottom line, let's review what you're saying to review.
Yes.
To review, it's that we want to eat only when we're hungry. And when your body needs more nutrients, so you're not going to sustain the muscle, the demands of your body, it'll give you a signal to eat. And that's why, even though we're going to have this canapé reception at 5:30, it's going to be a very nice time, and we're going to have a good time together, you can only look at the food in the canapés. They're not edible. Because how could we be hungry by 5:30, right? Sitting in here all afternoon, not exercising after that delicious lunch, right? So we're going to either have to all meet, go for a jog or something, or let the canopy, or I don't know what we're going to do, but maybe that canopy reception should be at 8:30 or something, What's that? Yeah, maybe if we stall long enough, we could. That's right. It should be part of your dinner. It should be part of your dinner. But of course, eat lightly, pick and choose. But the point is, we should, in an ideal set, this is a party. It's a goodbye. I guess it's an unusual circumstance. It was a joke, so whatever you do is fine. But the point is that in a real life situation, we wouldn't be eating or snacking at 5:30, right? And then when your diet, and here's my point though that I was making, when you get very healthy, and your diet is so healthy and rich in micronutrients, your body works more efficiently. You can taste food better. It's not only that you're tasting better because you're hungry, your taste improves as an organ. Like your heart ability improves and your kidney works better, well, your taste buds work better too. And your digestive efficiency increases. And your metabolism improves too, which means it slows down. You don't need as much food. You can survive with less food because you're getting so much good nutrients, and you're utilizing those nutrients so efficiently, and you're digesting them efficiently, and you're absorbing them efficiently, and you're putting them to work efficiently without waste. Which means you can eat less food without getting too thin. You can maintain your muscle mass and your strength without having to eat these huge amounts of food, right? And because your metabolism slows down, you're aging slower when your metabolism is slower. Metabolism measures the rate at which your body is revving. You want to keep that engine revving, of course, you're going to age it more. You want to cool back on the accelerator, you're resting your body. You're not working it so hard. So your body is going to age slower and you're going to live longer. So the trick here is not to look for tricks that you can speed up your metabolism so you can eat more food and not gain weight. We want to slow down our metabolism so we can eat less food and not get too thin. It's very easy to keep ourselves thin. It's just we live in a nation where we have so much food excess and toxic food around us that everybody's just overeating so much more food than they need, right? And then the people say, well, I can't lose weight, it's too tempting, and there's food around us, and it's social, and I'm used to eating this way. But that's what we're talking about, that how much when you eat so healthfully, your pleasure is enhanced dramatically, because not only eating when you're hungry, because the food tastes so much better, and you actually enjoy eating less, and you feel better, and you have more of your life to live. So people are starting to experience, as even though the food tastes really good, we don't need as much of it to feel satisfied. And if we overeat, we're not going to be hungry for the next meal, not going to feel like eating again. So, and the last part of that is that a person who has a genetically slow metabolic rate, they can eat less and not get too thin. And their metabolic rate is slow, which means they're probably going to live a real long time. But to have that person deposited into the American toxic food environment, and that person's doomed to diabetes, obesity, and early death.
If you are having a goal of increasing your muscle mass, that doesn't necessarily mean that you're speeding up your metabolism. Like especially if you're a woman and you're going from like a 26% body fat to, like you were saying, increasing your body fat percentage. That's not
lowering your body fat percentage, right, through exercise.
Yes.
And as you do more exercise, you'll burn more calories from the fat on your body, and you'll be more efficient at digesting your food, and your diet will have the adequately muscle-building things for your muscles to build. But you'll build muscle, and they'll strengthen muscle, and you'll make muscle more dense, and your body will suck fat off it. And you're not like feeding your muscle, you're letting your body feed your muscle. So you utilize some of the extra calories that you consumed in the past and not try to feed it with eating extra food. So let hunger be your guide, because you'll only be hungry when the muscle is demanding more calories. So if you're not hungry, don't eat.
after an intense like weightlifting workout. There's a lot out there now about personal trainers saying, oh, you have a 20-minute window that's ideal for you to consume your calories, and then it's less ideal if you do it within 30 minutes, and even but still important to do it within an hour. This is very prevalent now, and if you could just address that in any way.
Well, it might be a valuable concept to eat to eat within an hour of when you work out. If I was training you to compete in an Olympic event, that might be a valuable thing because the amount of time difference and competitive difference with regard to power and exercise capacity between you and another person might be a millisecond, and that could mean a gold medal or no medal at all. But here we want to maximize health and longevity, and not necessarily maximize muscle building and mass effect of what you eat, and so the little differences become more irrelevant.
So if I'm telling clients to eat when they're hungry, and they say to me, but my trainer says blah, 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 I need to eat within 20 minutes, what I've been saying to them, but, well, are you hungry?
Exactly.
Okay.
And usually when I go work out, within a half an hour of coming home, I'm starving. I really want to eat. And I listen to my body. And I like to work out because I love that feeling of being really hungry after I work out. We went walking all morning, and I came back and I was really hungry for lunch, real hunger, and it really made me enjoy lunch more. So that's a great feeling to have.
I'm a yo-yo dieter. One of my worst yo-yo, I lost 60 pounds. And when I got down 60 pounds, I could do fewer push-ups than I could when I was at the upper weight, even though I had a lot less weight. And that surprised me. I thought that, without having to worry about protein, that I would probably increase that number.
Right.
So I was just wondering about.
I don't know. I'd have to look at the diet you were following.
Yeah.
What you ate. I mean, obviously the nutritarian style diet, even though it could be vegan or contain a little bit of animal products, but nevertheless, it's primarily plant-based. You're not getting most of your protein from animal products, but it's designed to be rich in protein. And that complementary amino acids are maximized on this diet style with all the green vegetables, the beans, the nuts and seeds, the use of only the intact grains. The fact that we're putting all the healthiest foods in the world together means it also has a very high biological protein content as well. So you should be able to have great muscular response. And I have a lot of athletes who use this, and I've used this as an athlete most of my life too. So the point is that using my body as an example, per body weight, as you age, you should be pretty strong. More chins, more push-ups. You're not going to get to be huge, but per your body size, you should be strong and healthy and fit.
So if I'd been following the diet 100%, then it should have gone up.
Yes, there's probably something you did wrong.
Okay. The first book I
That's the
read,
problem with maybe the so-called high carbohydrate, low fat plant-based diet. Because once your diet is so much carbohydrate, you're not eating nuts and seeds, not paying attention to green vegetables, your choice of carbohydrate isn't bean, it might be, all potato, then there could be the chance that you have higher triglycerides, an extra roll of fat you can't get rid of, and losing some strength. Those, that's the problem with those kind of things.
I did a fast, and right at 3 days, everything started going south. My blood pressure went up instead of down. I started feeling terrible, and I broke the fast the next day.
You're right. You shouldn't start a program with a fast. You should start a program with eating healthy, take care of your health, making sure you have no nutritional deficiencies, and then fasting is a more advanced technique that we use as a lifespan enhancing or therapeutic intervention for people with certain conditions. The fasting is a tweak add-on to the healthy diet. So it enhances the detox and could exacerbate a deficiency that's existing beforehand. And Americans are deficient, and they're toxic. So we don't want people to start fasting, certainly not water fasting as the initiating stage to clean their taste buds. You want to eat healthy, detoxify slower, make it safer, get healthy first, then you can do a fast down the road. That'll minimize the chance of having some kind of intense detox crisis or something. And we don't want people on medications fasting or just stopping medications, jumping right into a fast. In other words, get healthy first, and then you can utilize some fasting down the road.
What tips or tricks or special needs do I need to do as a person with early prostate cancer?
Well, you need to follow this program.
Right.
There's anything additional you should do?
I saw juicing on your website, adding juices to that, or...
Right. I do call it, I have an anti-cancer protocol in one of my newsletters, right? And I call it the high cruciferous diet. So I add some juice to it, and I put some kale or collards or parsley in the juice, right? And we give people, with prostate cancer, make sure they have a little more tomato products in their diet.
Okay.
Make sure they're using not just the cruciferous vegetables, but also the parsleys, the parsley, and the green herbs, and the onions and the mushrooms. So it's just really making sure you stay on the really healthy version of the diet, and you're not liberalizing it too much and doing a 90% version, but the real hardcore version of a eat for health or nutritarian diet.
Thank you.
Yeah. And I've had marked results and remarkable results. And prostate cancer is what makes it so nice to take care of is because there's you can measure it with a blood test. It's so easy. So you can see the PSAs going down, staying very low, gives the person comfort, the doctor reassurance they're on the right track. With breast cancer, it's harder because it's not as easy a measurable test we can see to see how the person's doing from the, it's more of a guessing game. So you can see it in your blood that you're doing well in the program because your PSA is dropping and staying down.
Dr. Fuhrman, I have a whole list of questions, so I'm not going to go over them all. Okay, this one I think is really useful for a lot of people. It's asking about the detoxification process, and specifically, are there any physical dangers, which I think is important? How long does it last? Anything that we can do to relieve the discomfort? Can you just discuss that topic quickly?
Sure. Most people, when they're moving from a standard diet to a nutritarian diet, feel ill the first 3 days, a little ill. And the illness is fogginess, mild headache, sometimes a low-grade fever, sometimes a mild sore throat, sometimes diarrhea, sometimes a feeling of slight itchiness, and otherwise fatigue. That goes away usually within a few days, and for 95% of people, by the 5th day, they're fine. And any residual detoxification is kind of diminishing to almost nothing. Now, it doesn't mean that in some cases people might feel ill for 2 weeks, but that's more unusual. Usually it passes relatively quickly. And people know that similarly, a person who stops coffee feels ill for the first 4 to 5 days. By day 5, they really cough, the headaches are gone as well. So it seems to be about the same amount of time. And some people are coming, the worse their diet was, the more coffee they were drinking, the more soda, the more sugar, the more junk they were eating, the worse they feel. So if you want to not feel so bad, eat, carefully, and then, you can stop your coffee and stop, in other words, cut back a little bit and then drop it all out. But but most people who come to these programs, and I got a lot of experience from taking care of the Whole Foods people, and one woman lost 24 pounds the week she was there. 24 pounds the 1 week, eating this food, on a buffet, eating all you can eat. And I said to her, to lose 24 pounds in 1 week, the body can only lose about 4 pounds of fat in a week. That means you lost 20 pounds of water. How could you possibly be eating so much salt and so much crap to lose 20 pounds of water in 1 week? Was it that and she was pretty heavy. I said, were you eating every meal out at fast food restaurants or something? And she said, Yeah. I think every meal at fast food restaurants. And I said, you work at Whole Foods. You don't eat any kind of food that, so it's that people would lose 11 pounds, 15 pounds, 20 pounds. So I saw a lot of people detoxifying. Some of them had to go to their room, lie on the back of the room, but they were all, by the 5th day, they're pretty much doing great.
Well, hopefully the people that were eating fast food every day are now just going to go to Whole Foods or some kind of natural market and just make that their fast food joint.
But we followed up these people though, and they've continued to lose weight and do very well. The results have been really exciting.
Can you comment on attention deficit disorder in adults? Do you ever recommend medication for them? And if so, would that be in addition to or instead of fish oil?
Well, don't forget, I did say attention deficit disorder doesn't need fish oil. I only said major depressive disorder does better. The scientific studies indicate that vegan DHA is not as effective as a product that mixes EPA with DHA in the scientific literature for depression, for major depressive disorder. But there's no data to suggest that's true for attention deficit disorder. Just the DHA alone could be sufficient, so they don't have to have fish oil. And the question is, what besides that might be helpful?
Would you ever recommend medication for adults with ADD? And if so, would that be in addition to or instead of DHA?
Well, those medications do have significant side effects. I mean, I as much as possible, try not to recommend medication. I can't say I never would not use medication if a person was completely non-functional, but I can't remember any case where I've ever actually prescribed the medication myself, given to a person. Maybe I've had them continue it a while until they got healthier, but I can't remember ever actually increasing it or giving it to a person who wasn't on medication. I would never initiate or start a person on those drugs, you know what I mean? But maybe they'd be continuing on it for a while I'm working with them to get them more functional without it. So I certainly think that the standard American diet, which causes us to develop disease, also affects the brain, which is an organ, and our concentration, our focus, our fatigue, and our attention is lost when we're not healthy.
One person here has never taken drugs and has very bad osteoporosis and wants to know that if she starts to eat really healthfully now, can that reverse? Can osteoporosis reverse if it's already very advanced?
Yes. In other words, assuming she has the capacity to increase her exercise tolerance, the answer is yes. If there's some limiting factor, like broken bones, spinal collapse, pain, bad alignment, there's something that prevents her from exercising safely, then the answer would be no. She could continue to be in bad shape. But if she has nothing that structurally impairs her from actually building up the exercise in her body and getting more physically fit and stronger and building up muscles, then the bones will build as well.
Okay.
So she has to target those areas that are weak and do the exercises to support her lower back and making sure her vitamin D is adequate and she's doing the right diet, which is not acid forming.
Does a nutritarian diet have success with sleep apnea?
Oh, that's absolutely. I mean, obviously, most garden variety sleep apnea is caused by thickening of the neck tissues due to obesity. And so of course it works. And some of the other sleep apneas is not obesity related, is still linked to inflammation and swelling in the neck so yes, they do typically, that's one of the big advantages of losing weight and eating a healthy diet is shrinking tissues, helping carpal tunnel syndrome, not getting swelling in your wrists, swelling in your neck, nerve compression, poor circulation, and better room for your nervous system and your lymphatic channels and blood flow to flow around the body the way it's supposed to.
Great.
Doctor, recently I had done my blood test in India and my uric acid was little more than normal.
Was high?
Was high, yeah.
Right.
High, I mean, not very high, but high. So the doctor advised me not to eat greens because he said I can get into...
Not to eat greens?
Yeah. I mean, he said that if...
Uric acid is a byproduct of excess protein metabolism. So not to eat beans, you said, not greens.
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 Spinach and broccoli, everything.
Right.
But
you sure you meant uric acid, not oxalic acid? Certain greens like spinach are high in oxalic acid.
Yeah, because he said if I don't do anything...
Meat and brain and liver are high in, in uric acid. That causes gout, oxalic acid causes kidney stones. You're not mixing up the two?
No, he said if I don't do anything, I'll get bone problems, especially where the joints are.
You'll get what?
Bone problems, especially the joints.
Gout, joint problems,
yeah.
So that's uric acid.
I think they call it the gout disease.
Gout, right?
Yeah. So for gout disease, he recommended, before I get into that, he recommended to come out from greens till it's normal. Now, he gave me some medicines, which actually I didn't start also.
Yeah. Well, simply, most people who just follow even a vegetarian diet or a nutritarian diet and cut back on animal products and lose weight, they don't have that issue anymore with gout or uric acid. It normalizes, it's pretty easy to fix. Okay, so I don't even think you have to pay too much attention. Just follow the basic program here, and you'd be fine.
Thanks.
Sure. It's too easy to, that's, typically goes away pretty easily.
Yeah. Doctor, are peanuts considered to be among the good nuts?
Are peanuts considered the good nuts?
Yeah.
I don't consider them to be as nutritious, and also as the other nuts and seeds, and also they don't taste good when they're raw. The Spanish peanuts, the little ones have a good taste, but the peanuts taste better roasted. So I think that peanut is not my most favorable nut. On the other hand, I eat them because I enjoy them once in a while. And the medical studies on peanuts show that they still have protective effects against cholesterol lowering, and there's still benefits for the heart. So I'm not saying they're bad food, they're just probably not as good as some of the superfood nuts and seeds.
Is pseudo-gout one of the conditions that can be reversed with the nutrition?
Very easily. That goes away pretty fast when you do this diet.
How fast? How fast should someone expect results?
2 to 3 months.
And is there anything to enhance it, or just the standard diet?
Just a standard program.
Okay.
It's people just always report it goes away.
My question is about my 20-year-old daughter who, she's lean, she has very low body fat, extremely athletic, and probably like level 1 of Eat for Health that she follows. And she hasn't had her period for over a year. And I've had her tested and brought her to a lot of doctors, and they seem to only want to just put her on the birth control pill to bring it on, and I feel like that might be masking over another problem. So my question is, could it be a nutritional deficiency, or should I be concerned about it, or just...
The average age of puberty in this country today is 12 and a half. The average age of puberty in 1840 was, in Central Europe, was 17 and a half, right?
That's when she started at 18, but then it kind of stopped.
Yeah. My daughter had the same thing. I had a daughter who was athletic, and she had her first period around age 18, and then stopped around age 20 and came back at age 21, 22. She starts getting more regularly. And they're athletes. They do a lot of exercise. Their body fat's relatively thin, and it's nothing to be concerned about.
Okay, good.
So I think that, and there's significant scientific evidence to suggest that delayed age of puberty and being thin in those age ranges has a marked effect at decreasing risk of breast cancer later on in life and leading to longer lifespan.
I've been on blood pressure medication for a while. I would like to get off. The last time I saw my doctor, it was 106/69, and he cut it in half. The other day when I had my health screening here, I didn't take my medication in the morning, and it was 110/76. So my question to you is, can I just quit? Do I have to gradually quit the medication?
It depends on what type of medication you're taking. If you're taking a beta blocker, even if your blood pressure is low, it still should be gradually reduced because it can lead to a rebound high pulse. But if you're taking any other medication, like if you're on just a calcium channel blocker or an ARB or an ACE inhibitor, it should just be stopped because you're over-treating yourself, which is causing more harm than good.
Okay, well...
If you're on a beta blocker, cut it in half again right now.
Okay.
If it's already cut in half and the lower dose doesn't exist, you're on the lowest dose of that medication available, then take it 1 every other day. If you've taken 1 every other day for 8 times, 4 doses over 8 days, and then stop it.
Okay. And then
So you're on a beta blocker? What's the beta blocker you're taking? Metoprolol.
Yes.
What dose are you taking? What dose of metoprolol are you taking?
I don't know. I can't remember.
Well, whatever you're on now, cut it in half.
Okay, well, I'm on like half a pill each day.
Of the lowest dose it comes in?
That's pretty, yeah,
It comes 50. You're taking 25 a day.
25.
Then take it every other day for the next 4 doses or 8 days, and then stop it. You don't need it anymore.
Okay, what about the diuretic and,
You didn't tell me you were taking a diuretic.
well, I'm sorry. Yeah, there's a diuretic that I'm taking with it.
You should stop the diuretic first before you stop the beta blocker.
Okay,
Because with this type of diet, it's going to cause more chance of electrolyte deficiency. So just stop the diuretic at this point. Just take the beta blocker. Wait a few weeks and then do what I said about the beta blocker.
okay, all right, thank you.
Sure. What's the dose of diuretic you were taking? Are you taking hydrochlorothiazide? HTC, is it a combination pill or is it just a 1 pill?
It's just 1 pill.
It's probably hydrochlorothiazide.
I think so.
You're taking 25 milligrams, 12.5 milligrams, 25.
I think 25.
Then you can just stop it.
This is a question from your heart disease presentation, specifically your slide on vegetables and endothelial function. your quote from the Lancet regarding both meta-analysis and brachial artery vasodilation tests, which increase endothelial function by the consumption of vegetables. I know that there have been studies where the consumption of one portion of bad oils have been measured in a brachial vasodilation test to show it decreases endothelial function. Have there been any similar studies done on the consumption of seeds and nuts?
I'm not 100% sure. I think there have been, but I can't, not 100% sure about remembering that study, but I think I have seen it. I'm not sure.
Okay. And if there is such a study, do you have any idea where we'd be finding the medical literature?
Oh, well, you know what I'll do? I'll search when I get home. I'll pull up the study and I'll post it on Disease Proof. I think I have posted one there. We can see if we can plug in nuts, seeds, and endothelial function on Disease Proof. See if there's a study posted there already on that subject. If not, I'll find the study and post it there.
My question's on weak nails and hair loss. I'm taking half a dropper of DHA, a tablespoon of flaxseed, at least 1 ounce of nuts and seeds. Ever since I've started eating nutritarian since last August, in the shower there's hair in the drain and my nails just won't grow. Do you have any other suggestions? I've also added biotin.
Well, you're adding things you're not low in wouldn't really do anything positive to you. The major cause of hair loss when people change their diet is some type of stress. And that stress could be surgical stress, a flu, emotional stress, getting in a car accident. It could be rapid weight loss, like fasting, or just losing some people who lost a lot of weight at the start. There's going to be some hair loss, and that hair loss is kind of a changeover stress-related hair loss. It's called, the scientific term is called telogen effluvium, and it lasts for about 6 months after the stressful event. So if you give birth to a baby, you will lose hair. 6 months later, you'll still see hair dropping out. But a year later, you have a full head of hair better than when you were before you even had the baby. So there could be some hair-related loss to the initial phase of weight loss that could then continue to occur 6 months after your weight loss has slowed down. It could still be occurring.
Okay, so just sort of wait it out.
So just wait it out, it'll come back to normal again.
Okay.
That's correct.
Thank
As
you.
far as your nails are concerned, the only problem with the nails are that people put their hands in water too much with the extra washing of vegetables. Their hands are always in the water in the sink so wear gloves and keep your hands out of the water so you don't get so they're more dry, so they don't weaken.
What's the accurate way to measure body fat percentage?
The most accurate way is when you get in those water tanks and you blow out all the air, and they measure your weight underwater and then measure your weight on top of the water and they calculate your body fat percent. That's the most accurate way.
Where do you have that?
I have one of those machines in my backyard. No, I'm just kidding.
I'll be there.
What's that?
I said, I'll be there.
I'd love to have one of those machines. I was calling up one of these body fat companies who drive these machines back in a truck, and I said, well, could I buy one of these machines and I can drive it around with me? I could have it in my office. And it was quite expensive, though, a little bit more money than I wanted to spend on it, so I didn't do it. And I said, well, is it portable? They said, oh, yeah, we have a portable one. We could put it in this big container and you can ship it on a plane. And I said, well, you could ship it in the cargo of a plane area. You could ship it around. I was saying, get one of those machines at the conference and have them. They have ones that blow air into the machine. You get in this thing, it's this big booth around you, and you make it real tight, and they blow air into it. And it measures your body fat percent. Should do that one year, but it's so prohibitively expensive. It was $4,000 to ship it, and $20,000 to rent it, or $50,000 to buy it. It's so expensive. But these machines, they were out there and they exist. I guess if you're a big corporation, you can own one, with a corporation bank account or something,
Well, so then how do we find out our body fat percentage, since that
You also have a way you could do it with calipers, by measuring your body with calipers and using this mathematical calculations on an internet site. You could type in, determine your body fat percent with a caliper and tape measure. And they also have these scales you could stand on with electrical impulses, and they give you a body fat percent, but they're off within a couple of percents. They're not very accurate, so you're not going to. So a 12% could be a 9%, or a 9% could be a 11%. So the ones you stand on are not quite as accurate as these real expensive machines. The athletes, the football players who work for professional body teams and the Olympic athletes have the real official, either air or water-based machines in their training facilities, so they can determine that. And some of these world-class athletes, have body fat percents around 5% body fat. It's amazing.
Is there a correlation between nutrition and the high increase of autism? And is there any reason that there's any reason it's a 4-to-1 ratio for boys to girls that get autism more?
Well, autism is multifactorial. In other words, it's not clearly caused by just this, vaccines, mercury. It's caused by, and I think that the major factors causing autism are things that are lifestyle factors in the mother, prior to pregnancy or during pregnancy. So in those lifestyle factors that we're going to find out in years to come. And it could be exposures to insecticides sprayed around the house. And it could be exposure to things other than food even. We know, for example, that Parkinson's disease is now showing more and more links to certain organophosphate chemicals. And and some people seem to be more sensitive to certain these chemicals in their environment. And some of the chemicals are not even food related. They're in cleaners and they're in chlorine bleach people are losing in their house. So
why would it be 4-to-1 boys to girls?
Maybe the development of a boy is somewhat susceptible to some of these causes that are. So I really do think that in the future we're going to know more of these causes of autism. So we have to be a little patient and realize nutrition probably does play a role, because just like Parkinson's disease is predominantly caused by a toxin, but poor nutrition and DHA deficiency exacerbates the sensitivity to those toxins.
Will high C-reactive protein levels normalize with a nutritarian diet?
Yes, I mentioned that earlier in one of the lectures, that the reason some of the other physicians who practice lifestyle medicine want to monitor their C-reactive protein levels in their patients and show them going down. And I could do that, but I don't even bother much, because they always go down, and they go down so beautifully and so strongly. It's not something I really feel like I have to watch. If the person's eating the right diet, it's down. Unless they have some disease that we're not considering, like cancer or an autoimmune condition. But if yours is just elevated to a bad diet, you eat a good diet, it goes down.
Okay, can you address how to treat urinary frequency and urgency without drugs?
Well, it depends what the cause of urinary frequency and urgency is. I mean, obviously, a lot of cases it's that there's bladder inflammation due to a bad diet, due to eating improperly, and drinking soda, diet sodas, poor nutrition, inflammation. So clearly, other times it could be of nervous stimulation, spinal collapse, a back problem, pressure on the pudendal nerve. There could be a whole host of different causes of that. But in any case, we start out with giving people great nutrition, then a physical exam, a blood test, analyzing finding out more about their general health, an examination to see if they have prolapse of their vagina, uterine prolapse, uterine prolapse that could be pressing on their. So clearly we have to, an examination, a physical exam, and a more investigation to what the cause could be would be a starting point.
This woman's daughter has been vegetarian her whole life, which is 22 years, but she's not vegan. When she was 9, she developed allergy-induced asthma, uses an inhaler frequently because she can't breathe, so it sounds pretty severe. What can she do to get off her inhaler and stop having asthma attacks?
Well, I discussed that in some of the disease-specific protocols here. We're saying that asthma and allergies do respond to these protocols, but they take a long time to respond. So we don't stop the inhalers at the beginning. We get them on the healthy program for at least a few months first. And likewise, we see it takes 3 or 4 or 5 or 6 months to get their nutrient levels to normal as we fix any potential deficiencies. Make sure the vitamin D is adequate, make sure the fatty acids are adequate, make sure the nutrient scores are adequate. Once we have this person in excellent health, then we start to taper their medications, And sometimes you have to leave them on a little bit of medications for a prolonged period of time. Less medication, maybe it's a year and a half, and then we usually start tapering them some more. When we finally get them, when I'm really satisfied that they require a little bit of medication, doing that final taper, it might be the fact that as I'm removing their medications after a year of doing this, they're going to do a fast. And they're not going to eat for that week. And so they'll allow the body to recover from their asthma. And so we have a really good success rate of combining the nutritarian diet style, micronutrient adequacy, making sure no deficiencies are present, and incorporating fasting when needed to have this person make a complete recovery from asthma. And it's a really great experience for the person and for the doctor working with these people, because so many people are waking up at night to take inhalers. They can't take an exercise class. You'd have no idea at how much being asthmatic interferes with a person's quality of life. And when it's so troubling to me to go to my son, to watch my son play with his friends, who they're on the trampoline or they're on the backyard or they're doing, and they're all running in the house to use their asthma inhalers and they can't play. and they're all eating junk food. They're all living on garbage, and they're all can't breathe. It's just utterly amazing. It's like it's really a major interference with normal life.
Can you comment quickly on food intolerance? Not food allergy, but food intolerance. Is it a myth? What are your thoughts?
I think that people have some food intolerance and digestive disturbances, but of course, the blood there's a lot of people that do those either IgG blood tests or ELISA-ACT blood tests or some other type of blood tests that are expensive that tell you which foods you're sensitized to, and they're not really accurate. And people will carry around these cards in their pocket thinking they can eat this and they can't eat that. So the best way to really tell is to eat a food regularly. If you're having trouble with a food, trial and error. And start with small amounts and see if small amounts don't bother you. Because very often all food intolerance is that it's more of like you haven't accommodated your digestive tract to handling it better. So I do encourage people to have as broad a variety of food in their diet as possible and to eat a variety of natural foods and try and very often when they improve their nutrition, improve their health, those food intolerances go away anyway, especially if you start just eating a small amount and give the body plenty of time to adapt to it.
Can you discuss bipolar and medication of Ramectal 300 milligrams a day following a vegetarian diet? I'm thinking more in terms of some of these general psychiatric problems that a lot of people, whether it's bipolar, schizophrenia, whatever else. Can you comment on this?
Yeah, I did talk about general depression and how responsive it is, and it's the same thing that we want to do everything possible to keep our population as healthy as possible because that's going to prevent these diseases from occurring. And in the early stages in which they occur, that's your best opportunity to help people not be on medication the rest of their life. And some of these, and the amount of, how we should say it, the amount of brain biochemistry imbalance that's there is different from one person to another. So there are mild cases that can recover with nutrition and good fatty acids and sunlight exposure, and other people who maybe can't and need a little bit of medication. So of course we want to maximize the lifestyle interventions that can help these people cope better, and if they need medication, they're going to take less medications, and out of the medications they're going to need to use, they're not going to have to need the most toxic psych drugs. They can use the safer, lesser toxic ones. So clearly the whole point is, when possible, not using medication or minimizing the use of medication when absolutely necessary.
I've been seriously ill with Samter's Triad and on steroids for 6 years. And the food that I'm eating now is contraindicated to Samter's Triad, but I've had the aspirin desensitizing. Am I ever going to be able to get off of the aspirin?
I think that you should work one-on-one, either have a phone consultation with me, because we obviously don't have to live in, where do you live?
Reno.
What, Atlanta?
Reno.
Reno, Nevada?
Yes.
Yeah. Why don't you set up a phone consult, go through your whole medical history with me, what medications you're on. We'll go through your history and see if we could really adopt, modify, change, and get you to really come up with a business plan, because obviously you have a more unusual condition.
All right. Thank you.
And we can, some of these things, and there's some things we can do that can help your condition.
I hope so.
Yeah.
I'm tired of being sick and tired.
I had a very high antioxidant number of 70,000, and I'm wondering if you think that means that I'm probably also getting adequate calcium in my diet. Like, would you see high antioxidant level but insufficient calcium intake?
Anything's possible.
I don't like taking the large calcium pills, so I haven't been taking them.
Well, clearly, green vegetables are rich in calcium. So you can get a high antioxidant level by tricking the machine and just drinking carrot juice, because it reads carotenoids instead of eating a whole natural. Or you could take a pill to get you level up for that machine. But if the machine is high because you have a good variety of natural plant foods, including a high intake of green vegetables, then it's very unlikely you're going to be too low in calcium.
Okay, and that's true. And what about the weighted vest? Do you recommend that even if there hasn't been any diagnosis of bone loss?
It's a great fitness tool. It's a great protection against osteoporosis. So yeah, I think it's good to have. It's a good training tool to have in your armamentarium.
And you wear it while you're exercising or not?
Yes, but the nice thing is it can help you build your bone strength or maintain your bone strength when you wear it when you're working around the house. When you're washing lettuce and chopping vegetables and cleaning your house or going shopping at the supermarket, you could be wearing it when you're wheeling the carts, getting things in and out of your car, moving around with a weighted vest on puts a little more an exercise tool.
Thank you.
Sure.
I have a problem sleeping at night, I was on a sleep tablet, and I got off of that because I don't want to take that. And so I was wondering if you had any suggestions. I did try a little extra melatonin, and that didn't seem to work for me. So I don't know whether I should just increase the dosage or...
Probably not. What are you taking? How much melatonin were you taking?
Oh, it was just a very small amount.
Like 2 milligrams?
Yeah, something like that. I didn't want to start with too much.
Yeah. Well, the main intervention is exercise. And I don't know what your exercise tolerance is or how much exercise you can do, but we're talking here about almost like weightlifting type exercises. But you have to find exercises that are appropriate to your condition, your bone, so you have to find exercises that are good for you to do, and you have to push yourself a little bit so you cause some stress on your muscle tissue so it stimulates growth hormone production.
Okay.
So you get into a deeper rest and sleep. You get more fatigued at night, and you have a higher secretion of growth hormone because you're doing some really muscle-building exercise during the day. In other words, what I'm saying here is that walking around is not going to do it. No. You can't just walk around. You have to work with bands and weights and resistance and really get your growth hormone stimulated. That's the first step.
Well, I do that, but maybe I'm not doing enough, so I guess I should increase it then.
Yeah, I don't know what you're doing. We got to look at it and see if we could. That's the starting point. Okay. And then do you do the EFAs, the essential fatty acids? You're taking the DHA?
No, I'm not.
The other thing that helps with that is exposure to light, helps with insomnia and sleep at night.
Okay.
It helps you time and peak your melatonin secretion and put you in a deeper sleep. So you could be living indoors too much. And when it's insomnia, getting more light and sunlight exposure outside is helpful.
Okay.
So especially in the morning, get outside in the morning. Here it's, and have your face be in the sun without sunglasses on.
Okay.
And then so the combination of getting more sunshine and getting more vigorous weight-bearing and weightlifting exercises is the starting point.
Great. Thank you very much.
Sure.
Dr. Fuhrman, I've been trying to work with a family member who's 64 years old, probably 30 pounds overweight, high cholesterol, arthritis, and very high blood pressure. In addition to that, she was diagnosed with hepatitis C from a blood transfusion she had many years ago, and now they're trying to encourage her to do this interferon treatment. She has no, I don't think there's any use of taking that treatment, but can I encourage her that if she really diligently applied herself to this, that she could see some improvement from the hepatitis?
Believe it or not, if a few years ago, I would have doubted that. Because if you asked me just and said, 10 years ago, do you think that the diet style you recommend, a nutritarian diet or nutritional excellence can reverse hepatitis C? I would have said no. It's like AIDS. It's an infection. But on the other hand, I've had patients who've done it and have recovered from hepatitis C completely, and it's predictably. And I was so shocked that they got better that I had to redo the blood test again 2 and 3 times just so I could be sure I was right. So the test that you get is called a PCR, an RNA hepatitis C viral load by PCR. And then we get this test that tells you the exact amount of virus, the quantitative number, the amount of virus circulating, and it can tell you how many of those viruses are in your tissues. And then it comes back to 0. Came back to 0, and I said, couldn't be. Must be a lab mistake. So the answer to your question is, yeah. I've got a few patients who came to me with hepatitis C make complete recoveries and have no hepatitis C anymore.
Well, it seems to me that interferon is nothing more than a chemotherapy that is far more damaging than helpful. And I know people who've ended up with liver cancer, and I suppose that's a side effect as well. But I just see the nutritional excellence as the only possible answer to some quality of life, with this disease.
And the person you mentioned was overweight and had pre-diabetes and high blood pressure and high cholesterol, and so what are you talking about?
Yeah.
If it doesn't help her hepatitis C,
Absolutely.
Get her health in shape. And if she does need to take some medication, you have to take the medication onto a healthy body, not onto an unhealthy body. More chance of having side effects and damage from the medication anyway, if she
Absolutely.
chooses.
Well, that's why I keep trying to tell her she lives on Tylenol and all this stuff going through her liver, plus 3 times the blood pressure medication. And I'm saying, anything that's affecting your liver, you shouldn't be doing. But thank you for that.
Sure.
I was going to ask you about the DHEA levels of the hormone.
That's right. DHEA is not the same as DHA.
Yeah.
EPA and DHA are the fish oil, the fatty acids, and DHEA is a steroid produced by the adrenal glands that's a precursor to estrogen and testosterone.
Right, and you said if it's a high level, you have a higher chance of breast cancer.
Correct.
Okay, I have a high level of that, and I was wondering if there's any way to drop that, or?
Weight loss.
I read that the estrogen, it's the delivery system. If you take it by a patch, it bypasses the liver and it's a lot easier on you.
It's safer. Yes.
Okay, are you like against the estrogen, or you think it's dangerous?
I think it increases risk of breast cancer. But I realize some women need to take a little bit or they can't function. But my whole message is that if you eat properly before menopause, your estrogen levels will be so much lower that your body will become more estrogen sensitive by pulling up estrogen receptors. And then after menopause, when your estrogen levels drop, it won't bother you as much and you won't be having to take estrogen. So I would prefer women not take estrogen. And if you do have to take it, then take a natural form through the skin in the smallest possible dose so you can function and sleep.
Okay, that Climera on a patch, it's a prescription.
Right.
But you consider that okay, or is that?
Well, there was things I'd probably prefer over that, to use more estriol other than an estradiol. I'd probably rather mix the estriol with a little bit of estradiol, and mostly I have to give a little weaker form of estrogen so I can better modify the dose to the lowest level possible, so to be effective, and not, because it's hard to control with those patches to the lowest possible level to give a person some relief, but not too much estrogen exposure.